Afternoon, everyone. My name is Teppo Heikkilä, as said, and I work as a senior medical officer in the Ministry of Social Affairs and Health at the moment. And first of all, I think that I should say that one of my main tasks in the ministry at the moment is the steering of postgraduate medical and dental education. But as Johanna said before, that this is her last day in duty, I have to say that this is my second last day in the duty at the moment, and well, I'm starting to work for Uusimaa County at the beginning of next month, and as a leader of change in the social and healthcare reform, planning and building the new county. But my new task is not going to be permanent, and I'm hopefully going to be back at the beginning of 2019. But even if and in any case, I think that I can say that as we have worked together for several years with Johanna around these questions, I think that this can be taken, if you want to, as a heritage or a testimony of medical education from us. But here I was asked to give you a short insight into our ongoing social and healthcare reform and what are the effects of it to the environment for medical doctors. Why is this reform needed? I think this is actually quite a good question. Since in several international studies done by, for example, OECD or WHO, the Finnish healthcare service system is usually ranked in top 5 or even top 3. So why we need to change a system that seems to be working? Well, the answer is it's working now, but we are not very certain if it's working in the future. Our population is getting old. It's estimated that Finnish population will be the oldest in European Union in 2060. Secondly, even if our social and healthcare system is evaluated to one of the most effective ones, we still have problems, especially in equal access to the services. This is also one of the reasons why we have some significant health inequalities in Finland. And then again, there is the problem with rising health costs and slow economic growth at the moment, which related to the aging population is going to mean problems in our economic capacity in the future. So, this reform is an answer to these problems we are going to face. The main aims of this reform are equal access to services, to integration between health and social services and primary and specialized level services. We are talking about horizontal and vertical integration, and also cutting the growth of costs in the long term. This is our current situation, and one of the reasons, another reason behind this reform. At the moment, the municipalities are responsible for arranging health services, and there are almost 300 municipalities. The municipalities need to join with, they are in response to arranging social and healthcare services, but they can do it with neighbor municipalities. And these joint municipalities, they are, or joint health centers, they are at the moment around 170. The main point here is that the average population of a municipality is around 17,000. And the smallest municipalities have only around 1,000 inhabitants. So the population is quite small for a municipality to be responsibility for arranging services. To provide secondary care services, each municipality is obligated to join one of the 20 hospital districts. And there are also 5 specific catchment areas around university hospitals that are responsible for arranging highly specialized health care. So, because of the problems in our current system, one of the main goals in our reform has been, from the beginning, to reduce the operators responsible for arranging the social and healthcare services. And this is planned to be done by establishing new counties. And these new counties are planned to, from the beginning of 2020, not 2019, as said in this slide, but 2020, they will be responsible for arranging all social and health services. Then again, it's also good to notice that the counties will also have some other duties that arranging social and health services. These will include, for example, rescue services, environmental health services, zoning and business development. So the counties are not only for health and social services. As in our current system, there are also going to be 5 cooperative areas in the new system, which are based on our existing specific catchment areas. This is I think one of the points where the only thing changing, almost only thing changing really is the name of the area. Although there's one thing which is going to change, and that is that in the new system also these 5 cooperative areas are also responsible for the social services, highly specialized social services, which is not the case at the moment. This county will be managed by elected councils, but they will not have taxing rights, at least at this point. And the funding of the counties will come from the central government. These are the 5 cornerstones of the new social and health service system. First of all, as said several times previously, we want to have stronger organizers, which are going to be the 18 counties. The 19th will be Ahvenanmaa, actually. Secondly, we are planning both horizontal and vertical service integration, meaning the integration of both health and social services and primary and secondary level services, as also said previously. Thirdly, we are planning to increase the freedom of choice of services for clients. Fourthly, we are trying to curb the increase of social and healthcare costs by 3 billion euros by the end of 2029. This is supposed to be done especially by changing both structures and also practices. And then our government is putting a lot of effort and hopes to the digitalisation in social and health services, but also in many other fields of society, for example in education. this is one of the main tasks our current government has taken, I think. This is the vision we have for the county in 2023. I will not go into very deep of the details of this vision, but if I want to raise one main goal, I think it would be more versatile service system enabling more personalized but efficient services for everyone. Then something about service integration. The main ideas in this integration are that the client has more possibilities to participate and make own choices. Especially for those clients that have a lot of different needs for services, a client care plan will be made in the future. The client will then get needed services according to this plan. And primary and specialized service providers and also social and healthcare providers will then collaborate in providing these services according to the service packages or agreements made in the county level. In this, the patient and client information should also transfer efficiently from one provider to another through digital solutions. During the reform, there has also been quite much effort to plan new solutions to provide social and health services. Especially, one of the main goals has been to enable self-treatment through different digital solutions and also develop some home and mobile services. The idea in this is to enable the better allocation of resources to the most needy ones. We are also planning to reduce our hospital network. The idea is to centralize expertise and by doing this improve the quality of care and also reduce costs. After this there will be 5 university hospitals, altogether 12 hospitals with extensive 24/7 emergency services and 8 other hospitals with lighter emergency services. But this centralizing of services doesn't include only emergency services, but also other medical treatments and procedures which are going to be centralized. This is the picture of the structure of our health and social services after the reform. Only at this point it needs to be said that this is a bit old one, as our Finnish colleagues and representatives know that we have had some political problems in our reform and latest changes came this summer and unfortunately this picture hasn't been according to these new plans. But it must also be said that actually the changes are not very big ones. So this is mostly accurate picture. As said before, the county will be responsible for organizing the services. The county will also be responsible to provide especially specialized and most of the social services through a different county organization. The client will be able to choose especially the provider of the primary health services. The providers of the primary services can be, for example, companies or associations. However, also the county has to provide primary services. but alongside with other providers. As I said before, we have a lot of hopes in digitalization of our different services. We believe that this will enable completely new ways to provide services and also develop different processes. Electronic services can also encourage residents to independently maintain their health and so release resources to those who need them the most. So, what will this all mean for medical doctors in the future? What will medical doctors need to know in the new service system, working in the new service system, to be educated for the new service system? For example, also the doctors need to have a new approach to customer service in their patient work. They will also need to be able to work better with other social and healthcare professionals and know how to direct their patients to other services. In the current economic situation and also in the new system, every worker in the social and health services needs to understand the economic effects of their everyday decisions. And I believe that this is not one thing that has been focused enough as today. As said, the digitalization is moving fast, and also the other doctors need to hop into the train. This will definitely need new competencies. The reform itself has said to be the biggest change management task in the Finnish history. So everyone in the middle of the change needs to know what are the key elements of the change. And of course, the doctors need to know in what kind of system they are going to be and are working in the future. Finally, from the education perspective, this all would mean that there needs to be all new flexibility in education. I personally believe that we would need to focus on our medical education more as a continuum, from undergraduate to postgraduate education and finally to continuous professional development. We need to rethink what should be educated in different stages of this continuum. I believe that this is the best, probably the only way to respond to the need of our rapidly changing world. So, thank you. If you want to have further information, you can go to the regionalreform.fi.
Thank you. Teppo, any questions?
At this point, I need to say that if you have questions about details of this reform, I think, and I believe that this audience have plenty of them, I think it's better to focus the questions to the questions related to education at this point.
But Stephens.
Thank you. It's a huge project, and one of the things the students will need to learn is from their teachers, who are practitioners. So there must be some huge process to develop the current doctors in all these skills. And could you just say a few words about that?
Well, at this point, I think that only thing to say is to repeat what Johanna already said, that we have a project together with the Ministry of Education and Culture and the Ministry of Social Affairs and Health to first to recognize the needs for the current needs for competencies, and then like put the knowledge of these competencies and through to universities. So, but we have representatives of universities here, and I'm not sure how these questions are taken care in the university level at the moment.
It wasn't really universities; it's the current workforce. You know,
yeah.
you're making a huge change to the current workforce.
Yes, it's true. So sorry. So a bit misunderstood. Yes, the project we have with the Ministry of Education and Culture is at this point mainly focusing of the educational needs of current workforce. So we are first looking into the new competencies needed of the current workforce and how should we teach these new competencies through continuous professional development. And only after that we are taking the focus to the undergraduate education.
Yes, Rita Möller, Stockholm, Sweden. The changes, is this on? Can you hear me?
Yeah.
Yeah. The changes you are going to carry out are made in healthcare that are finalized with the tax money, with it's
yes.
government owned. What's going to happen with the private sector? How is that? Is that organized in the kind of way too?
That's actually a very good question. We at the moment, I'm not sure what I should say about this, but my belief is that at the moment one of the focuses is to try to get the private sector to provide also the services which are funded from the public resources. So we want to get more providers into our public system. But this won't mean, I believe that also after that there is going to be like private sector with alongside with the public sector. But one of the big goals in this reform is to get also the private providers to provide services in the public system.
So that the private sector is going to be aligned with the public sector. The reason I ask is that the development in Sweden has been that we have lots of private healthcare centers, and at this moment at our medical school we have more than 200 private healthcare centers in the education system. So it's just something you are going to plan to use here?
Hopefully, yes. Well, the discussion in this question, I think, is just begun at the moment. So I'm not sure yet, but I hope so.
Yes, thank you. You put on some very, very good questions. These are exactly the questions that we think at the Ministry of Education that should be thought, because it definitely changes the environment, because it's such a big part of the education is already on the job training. But what comes to the continuing education or the education of the professionals already in work, what you asked before is that this is definitely something where all the colleagues at the Ministry will try to think this fall, is that since the universities have the sort of monopoly in the medical training, and they have to think about these new competencies their students will need anyways now and in future years, perhaps they could also have a bigger role in the continuing education of professions. Because in Finnish legislation, the universities have also a task to participate the lifelong learning. So it's one of their responsibilities. So they could have a bigger role actually in the further education and training.
Thank you, Johanna. And one more question.
Thank you. I'm Inari Natri, and I'm the chairman of the Medical Students Association in Finland. What the students are really interested in, and what already came up, is that when the whole kind of healthcare system changes, where will we be educated and where will we be trained, and what is the schedule on when this will actually be decided? That is something that interests us very much.
Yes, very good question also. But I'll go a little bit back in my presentation. From the education point of view, it must be said at this point that most of the services still are going to be here. If we think current specialized healthcare, specialized medical services, they are all going to be here, basically. So this part here is only going to be primary healthcare. So the answer is that most of the education happening in the service system is going to be mostly like as it is today, I think.
Okay, thank you, Teppo, very much. It was very interesting topic, as you said already before, that you were ready to get many questions. But before coffee break,